Vikki Petersen here. I wanted to talk to you today about a syndrome or a symptom that's called panic attacks or anxiety attacks. Now the statistics on these are that it affects 10% of all Americans, so over 31 million of us have experienced these at some point in our life. And the causes are many and varied that are listed if you do any research into this, and things like taking certain medications, which definitely can cause it, diabetes, hypoglycemia, puberty, menopause, being pregnant. So there's a lot of different causes. But having recently had a patient who has been to the emergency room 3 times, only to be told she's having a panic attack and she needs to relax, and the common result of this is that the person is prescribed an antidepressant or an anti-anxiety kind of medication, and these kind of medications are very dangerous. They have very deleterious side effects, suicide being one of them, and so it's not something that we should take lightly the way we treat this type of symptom. So when she came in, I realized that A, I had never spoken about this in this particular forum, and that B, we have very good success in treating this. And usually the problem has nothing to do with anxiety. However, imagine that you suddenly couldn't get your breath. Imagine you're in a deep sleep and all of a sudden you wake up gasping for air. You can imagine that that would then induce a sense of panic or anxiety, of course. But it's not really the cause, it's more often the effect. Now, of course, you can have the person who gets suddenly bad news or suddenly gets very frightened and has trouble breathing. I'm not really talking about that. That makes sense. Hopefully it's a very acute type of situation, meaning it's not really going to happen again. It's not something that happens often. These are patients who begin with this and have it repetitively. And this woman reminded me when I was seeing her the other day that very often these patients say that the anxiety attack or the panic attack comes on when they don't feel stressed, which of course starts to make you wonder if there isn't a deeper cause. So the number one thing that we like to rule out is something digestive, meaning that you're actually eating, you're consuming a food that's causing your stomach to go into spasm. Now anatomically, if you think of the diaphragm, so the diaphragm is a sheet of muscle, and when we inhale, when we take a deep breath in, it goes down, and then when we exhale, it pushes up to let that air out. And so that diaphragm, of course, never stops working because we're constantly breathing whether we are awake or asleep. Just beneath that diaphragm is the stomach on the left-hand side of your body. If that stomach goes into spasm and pushes up against that sheet of muscle, it can be responsible for putting it into a spasm or almost paralyzing it. So then you're trying to get a deep breath and you can't because that muscle is not flowing up and down the way it should. When you're not getting enough air, you of course do panic, feel anxious, and then the heart will start to try to pump more blood to get more oxygen, and you can have heart palpitations. So all these things, though, once again, are secondary. So what's primary? Often we find somebody's eating something that they're sensitive to, it's putting that stomach in a spasm, and that's creating the diaphragm from moving freely, and they get a panic attack. The other very interesting correlation is that someone can actually have pinched nerves in their neck, and there's a nerve called the vagus nerve that goes to the stomach and the diaphragm, and when that nerve is not functioning well, you can reflexively get that spasming once again of the diaphragm. Sometimes people feel pain right in the area of their ribs, near their heart, near their stomach. Sometimes that pain can move around to the back of their body, that's a very good indication that it might be structural or neurological in nature. Chiropractic is very helpful with this. Physical therapy is very helpful with this. You can do what's called a diaphragm release. So these are the two major areas. Now certainly I mentioned pregnancy as a root cause earlier. That makes a lot of sense because you've got that nice big belly and it's kind of squishing everything in addition to your stomach. So women who are pregnant can have these, and via that same reason, the stomach is more getting squashed than it is in spasm, but really the same methodology as the person who's eating and is having a reaction to something that they're eating. So I really wanted to bring up this information because maybe yourself or someone you know is suffering from these panic attacks or anxiety attacks, and it's a catch-22 because the more you have them, of course, the more fearful you will be that you will have them. So people get on these medications, and of course these medications not only have side effects, they often don't work. So then you have the added effect of what the medication is doing to your body, and you can really get into just a horrible catch-22 or merry-go-round with this whole thing because nobody is really addressing the root cause. So I wanted to spend a few moments discussing that, and I hope it's helpful for you or someone that you know. Until next time, I wish you very good health.